Hey guys, Dr. Ross here with Inver Chiropractic. Going to be talking a little bit about shoulder injuries. Shoulder injuries are some of the most common things that we see for patients that come into our office, especially when we're talking about extremity injuries. So we see a lot of patients for shoulders, elbows, wrists, hips, knees, and ankle issues. Shoulder is definitely the most common though, and it's actually the most common extremity injury out of all of them, whichever office or type of office that you go into. Over 7.5 million people back in 2014, I think it was, actually went into the doctor for a shoulder issue. And with those, the majority of them, over half of them, are actually rotator cuff issues. So the rotator cuff itself is four muscles that are attached to the shoulder, kind of holds that joint in place. Because this is the ball and socket, you can see what happens. I know this guy's a little banged up, but the arm is kind of free floating in here, except it has a joint capsule and then it has these ligaments and muscles holding it in there. So what we need to do is we need to make sure that this is really stable, really strong, and have really good mobility. So a lot of patients that come in might have stiffness, they might have a little bit of tears in there that they're not ready to do surgery on. There can be things such as shoulder impingements, there can be frozen shoulder where they really have no mobility in the shoulder. There can be a ton of different causes, or sprained strains, and especially one of the most common types of shoulder patients we see are athletes. There's a ton of different stuff that come up with them, from small repetitive injuries to things that are really acute and are really intense. So one thing that we are really good at looking at is this a structural problem or is it a functional problem? So if it's structural, we might need to be referred out and go get MRIs and different types of imaging. But if it's more of a functional issue, that's something that you can do a lot of work conservatively, which is awesome for the patient, because if we can keep you up from under a knife, that would be beneficial for all, and no one likes to go through that because the shoulder surgery is pretty successful, but the problem is the recovery process can take a really long time for people to get healthy. So those are some really common types of shoulder injuries and why we see a ton of them in the office. So some of the big ones to recap: rotator cuff injuries, shoulder impingement, sprains, strains, and frozen shoulders. So if you have any of those issues, and if you guys have any questions on those, please comment below in the comment box. I'd love to answer the questions for you. I know it can be a little bit confusing sometimes with shoulder as to whether it's a really big issue or more of a problem that you can handle conservatively. So comment below, we'll get back to you right away. Otherwise, you guys have a wonderful day, and we'll talk to you soon. Thanks.